I remember talking about it in medical school, and the way they describe it in medical school is everything that you could diagnose amyloidosis was on the differential of possible causes in amyloidosis or any condition. And so what it is it's a buildup of protein that kind of gunks up the gears of anything. So it can go to the brain, it can go to the heart, it can go to the lungs, it can go into the nerves, it goes everywhere. So anything that you can think of, amyloidosis could be a cause of it. And so one of the things that it can cause is heart failure. And so if you have a heart attack or something that causes the heart to be damaged, then you have a reason. But sometimes we just don't know why they went into heart failure. And it may be this protein just kind of gunk up the gears in the heart and cause the heart failure. But it can cause all kinds of things. And so they estimate that about 3 million to 13 million Americans have amyloidosis at any time. And so it's there. It's just that we don't think of it because we think of other things first. And there's two kinds of amyloidosis. There's the genetic version, and then there's the acquired version. So if it's genetic, then there's some kind of a gene defect that predisposes you to make these proteins or makes them clump together to gunk up the gears. And usually it hits somewhere between age 20 and age 60. And again, because these are things building up, it kind of takes some time to kind of manifest itself or appear as a symptom of some sorts. But there's also the acquired version. And so if you had chronic inflammation, chronic injury, then that could kind of trigger the body to make more proteins, and it will happen later on in life, usually around 55 to 70. That's when the acquired one kicks in. And usually it's some kind of chronic inflammation or chronic infection or something that kind of confuses the body to make more of these proteins. Now, people who are dialyzed are more likely to get amyloidosis because the kidney can filter out some of this protein before it builds up, but the dialysis doesn't allow you to get rid of these extra proteins. So people who are dialyzed are more likely to have amyloidosis. So men are more likely to get it than women. And again, if it's genetic, then it could be passed on to family members who have it. And so you can do a genetic test to see if you're at risk of being likely to have this mutation. And so there are 120 different forms of it, but you can detect it by genetic testing. Some of the symptoms, basically anything you could think of actually could be amyloidosis, but there are some things that are kind of unusual. A lot of weakness or variability in blood pressure, pulse rate. Anything that fluctuates could be amyloidosis. Worsening memory loss, shortness of breath, bladder control, tingling in the fingers, temperature sensation loss. So it could be almost anything, and amyloidosis could cause it because it could get into any part of the body and cause almost anything. So if you don't have a good reason for something, or it seems like it's not fitting one piece of the puzzle, or it doesn't fit certain puzzles, then it could be amyloidosis. And if we're lucky, it will stay in one place of the body, but usually it kind of affects a bunch of things all at once. So people have a myriad of different symptoms, and so you think of amyloidosis. But it's often not diagnosed because it mimics so many other things. It could be mimic heartburn, it could mimic bladder infections, it could mimic a lot of things, COPD or whatever, but it could be something else. Okay. So the treatment is to, sometimes if it gets bad enough, to do chemotherapy. And so it's a pretty aggressive chemotherapy to try to knock out what's making the proteins or making them aggregate together. And if it gets bad enough, then the more dramatic treatment is actually, you just have to replace the organ. So if it goes into the lung, you just lung transplant. If it goes into the liver transplant. If it goes into the kidney transplant. So in severe cases, one of the treatments is transplant. But again, it mimics so many different things. The first thing is you have to diagnose what it is. And so you could biopsy that area and look for the amyloid protein buildup, or again do genetic testing to see if there's any risk of genetic cause of this protein building up. So again, memory loss, any bladder, nerve, muscle weakness, tingling sensations, heart failure, breathing problems, pretty much anything could be because of these proteins building up in the gears. So that's amyloidosis. Not common, but it is common.